this episode of This Week in Pharmacy History with your favorite presenters, Zach Skinner and
Cody Booker,
P2 PharmD students at East Tennessee State University, Bill Gatton College of Pharmacy in Johnson City, Tennessee, from Dr. Gimrick's History of Pharmacy course.
This week, our topic of discussion will be the auspicious event of the Nobel Prize in Physiology or Medicine in 1945. We will note what was occurring in the world during that time, the events leading up to the award, and how the winning scientist's discovery would change the face of war, medicine, pharmaceutical therapy, and mankind forever.
During the handful of years preceding the 1945 award, the balance of world power was in crisis. The world was in turmoil, and most crucial was the horrifying number of deaths occurring while Hitler carried out his evil agenda in the World War II Holocaust. Evolving war tactics and weaponry were creating the need for more effective medical practices. More responsive medicines were never more critical than amidst the vicious battles, atrocious conditions, and decimation of many soldiers and prisoners during World War II. New weaponry resulted in human suffering from amputations to septicemia. Ravaging conditions like starvation, freezing weather, and necessities for healthy hygiene lowered the human body's ability to combat other illnesses brought about by the war. War conditions meant more than political agenda. Men, women, and children, both soldier and prisoners, were dying in mass.
The discovery and production of penicillin was the miracle that would do so much to combat infection in mankind at a time when it was desperately needed. So just how was penicillin discovered? In 1928, while doing unrelated lab research, Scottish-born Sir Alexander Fleming, bacteriologist and biochemist at London University, accidentally discovered a mold that made an antibacterial substance. He called it penicillin. Sensing that he had discovered something of value to the field of medicine, he tried to pursue the substance's potential. He wrote a paper on his discovery and presented it to his colleagues, but he could not generate any interest in fellow scientists to pursue potential outcomes for penicillin. Without a team to provide knowledge and support, Fleming was not able to determine a means to bring his discovery to its full potential.
Over the next several years, another scientist, Sir Howard Florey, pursued his career in pathology from Australia to Oxford, Cambridge, an Arctic expedition, and even a Rockefeller Foundation fellowship with the American pharmacologist Alfred Newton Richards at the University of Pennsylvania. Nearly a decade later, in 1936, pathologist Sir Howard Florey became the director for the Sir William Dunn School of Pathology in Oxford. Using the experiences he gleaned in the past few years, in 1940 he established a team of scientists representing many science disciplines to exclusively pursue Fleming's initial discovery of penicillin.
One of the first on that team was the fiery biochemist Ernst Chain, a German immigrant who came to England after the Nazis came into power in Germany. Chain worked on purifying and concentrating the penicillin product. His methods were grueling and inefficient, although they would be improved upon by later scientists. Despite the time and energy, he soon produced enough of the product to test it for its toxicity on lab mice. They lived. Then he tested it on infected lab mice. Those administered penicillin lived. After a larger lab animal study, penicillin was proving its potential as a positive path to meeting the medical needs for humans. In January of 1941, Chain began testing humans with penicillin, and after a few problems with drug purity, he ironed it out.
Finding the resources to mass-produce penicillin was now the challenge facing Florey and Chain. Florey presented his production needs to British drug firms. However, only one firm offered their support in their Laresy war-beleaguered English drug industry. Florey then flew to the United States, where his American pharmacologist colleague, Alfred Newton Richards, who was now chair of the Committee on Medical Research Office of Scientific Research and Development, was convinced after only one presentation to support Florey in the production of penicillin. At the peak of the British-American joint production of penicillin efforts, over 35 institutions and thousands of individuals participated to produce the penicillin needed for the necessary clinical trials, for the Allied troops, and for mankind.
On December 10, 1945, Sir Alexander Fleming, Ernst B. Chain, and Sir Howard Florey were awarded the Nobel Prize in Physiology or Medicine in Stockholm, Sweden.
They will forever be honored because while they could have patented the drug and become extremely wealthy, rather they chose to save countless lives by giving penicillin to mankind during a time of great need.
These are your presenters,
Zach Skinner and
Cody Booker, saying thank you for joining us for this episode of This Week in Pharmacy History.
Good
night.